Hi, I'm Laura Pryor. I'm the Chief Quality Officer for Windrose Health Network. I started here in early 2001, so a little over 20 years, and it's very different how Windrose has turned out from how it first started when I started. When I started with Windrose, I came to work here because it was close to my house. I live in Trafalgar, and it was going to be a more kind of regular schedule that I was going to be able to have a little more time with my kids from the schedule I was doing at the hospital. And I really thought that I was going to be bored out of my mind here because in my previous life I worked in the emergency department, and I just thought I was not going to have enough to do, enough to keep my mind occupied, and felt like I was really using all my nursing skills in the ER. I was wrong. One of the things that for me made me fall in love with Windrose and just the idea that we're taking care of underserved people. My family had a lot of financial struggles when I was a kid, and fortunately for us, we had kind of an old-fashioned doctor that didn't really care how much money my parents owed him. He took care of us no matter what and let my parents pay him what they could when they could. And for me to be on the other side of that as a nurse and trying to help other people who were having some of the same struggles that we had growing up is extremely rewarding and fulfilling for me as a nurse. And that was probably my biggest surprise of what it was like to work here. When I started, we had about a dozen employees, and we only had the Trafalgar Center at the time. We had 3 exam rooms, and that's all the bigger we were. So to see where we started and then to be here along all the changes through the years has been pretty amazing to see what we've been able to become. All the new services we've been able to add. At the time we were doing family practice, and we had some very, very limited behavioral health services available. And to see how many centers we have that we're in all these other communities and we're serving so many other cultures of people, that's pretty awesome too. One of the other things that I like about working with Windrose Health Network is, besides the different lines of service by having pediatrics, family practice, and prenatal care, all the growth we've had in our behavioral health, to have behavioral health providers available in all of our offices and to be able to have telepsych available is such an amazing thing for our patients, to be able to have those services easily available to them. There just aren't enough behavioral health services anywhere in the country, and Indiana's no exception. I also like the fact that we have started expanding our care coordination team to be able to have nurses that can help patients manage their chronic conditions better. The idea that, some people have heard of the term patient-centered, and really, when you think about what does that mean, the patient is in the center of the care team. So much of what happens to patients, whether they have good outcomes or bad outcomes, whether their condition is managed well or not, has way more to do with what they do all day, every day at home than it has to do with what the doctor said to them in the office. I don't want to discount, what impact the healthcare team has, but it really has to be a partnership between the patient and the provider team. They have to work together. And I think some of my favorite memories really have everything to do with working with the group of people that I get to work with every day. I've got to work with some really special people over the years, and we work hard. We put in a lot of hours, but at the same time, there's no reason we can't enjoy ourselves while we're doing all this great work that we do for people. So some of the celebrations that we do throughout the year, especially every year in August when we celebrate National Community Health Center Week, that's always a lot of fun for us. We have different themes. We will dress up in costumes and get a chance to be silly and outgoing, and it's just very enjoyable. You know, I said earlier that I feel more fulfilled in this role than any other role I've ever done. And it has a lot to do with what we do for our patients, you know, that I believe in the mission that we're doing. I get to see the results of our patients who've been able to get services from us. But then also the personal enjoyment of the group of people that I get to work with. We have so many special people that work here. I think we do a really good job of hiring people that believe in our mission, and it's also their personal mission, and that's why it works so well. It's because we all may have different ideas about how we need to get a goal accomplished, but the idea that we all believe that that's the goal that needs to be accomplished, we figure out how to make that work, and people put their egos aside to figure out what plan is going to work, and then we just make it happen. So I've been here for 20 years, and maybe I'll be here another 20 years. I guess we'll see how old I am when I retire, but for sure I would like to see us continue to expand the behavioral health services. I'd like to see us have a lot more opportunity for care coordination and nurse management of patients. I think it would be really awesome if we could add dental services in at some point, because I think a lot of people underestimate how important dental health is to your overall well-being, and that would be another kind of good service for us to have. I especially would like to see a lot more patient involvement. I would like to see a lot more community involvement in helping us support different activities that we do, like our Extra Mile Fund. Right now, that's something that the staff for many, many years have funded that, and we've not really tried to put that out in the community too much, but I really see that as something over the next few years that would be a really good thing for us to be able to accomplish, so that other people in the community could help us support our patients in that way. I'm excited to see what we do next. You know, when I first came to work here, I thought, you know, I said earlier that I thought I might be bored, and that I wasn't really using all my nursing skills in this setting, but I was wrong about that. I feel like even though I'm not doing direct patient care in my current role, I feel like I'm impacting a lot more patients than I could if I were doing one-on-one patient care at the bedside. Being able to impact what kind of policies that we have in place, making sure that we have good systems to train our staff, and that we have opportunities for patients to give us their input and their feedback about what they like and what they don't like, and what they're looking for from us as a healthcare provider in the community. I'm just looking forward to more of that and more ways for the community to be involved in what we do.